I'm Nikki Scott. I am a women's health coach, and one of my core principles is to talk no bullshit. So sorry if you don't like swearing, but I'm a bit fed up with all the fluff that women are being given around their pelvic floor and pelvic floor treatment. So I tend to be fairly plain speaking, so hopefully that doesn't put anybody off. If you're not put off already by the fact that we've started about 25 minutes late because I was faffing around with trying to get myself set up. So yeah, anyway, here we go. Let me just, does that work? I just really hate my lights. There we go. That's better. That's actually all right. I've put it on a little shelf, my phone, so I'm not holding on to it.
Ah, brilliant. Thanks, Nikki. Sorry about all the technical stuff tonight. I just don't know what was going on with that, but we've made it. We're here. Thank you so
Yeah.
much, everybody, for your patience. And yeah, I'm just so grateful to have Nikki on my page talking about foofs because it is a really important conversation.
It really is.
And I think one that a lot of women are really embarrassed to talk about. And I think that's so brilliant the way that you do break things down and remove some of that feeling of being embarrassed so that people do feel like they can ask the questions, they can talk about whatever it is they need to talk about. And I know that you've got a journey that you've been on as well, haven't you? So
Yes, absolutely. So yeah, hopefully people will understand that it's it's definitely something that we should be having more open conversations about, really. And I think people get a bit scared and a bit embarrassed, and it's almost like we have been conditioned to be very British and not have conversations, because like in European countries they talk about stuff, they talk about vaginas, they talk about foofs and what's going on, and we just don't we don't tend to have that such open conversations. We all know these things are happening, but we tend to keep it to ourselves. So hopefully after this evening you'll know that it's actually okay to be having a chat with people or having a chat with me about what's going on with you. I my very quick backstory is, because I don't want to talk about myself so much now, is that I was a hairdresser for many years, and whilst I was a hairdresser I got pregnant with twins. I was very active. I like going to the gym like a lot of people, so I used to go to the gym probably 3 or 4 times a week before I had my kids. And then I got pregnant, and then I'm telling you this because I've thought in my mind that I was really fit and that everything was working okay and that I had no issues until I had my children. And then there was no real information given to me before I had kids about what happened to my body, or what was going to happen to my body. Even through the birth, I didn't really have the nitty gritty, all the details that I needed to prepare myself for kind of how I was going to be left afterwards. And to say that I was very weak and unstable was a bit of an understatement. I just felt very disconnected after having twins. And one of the major issues that I had, and that continued to be a major issue for a very long time, was incontinence. And a lot of people hear the word incontinence and they kind of think about an old lady sitting in a nursing home wetting herself, or having to wear like big incontinence pants because they can't not leak. But any form of leakage is incontinence. So even if it's just a drop or a massive flood, or when you sneeze, or when you get up out of a chair you lose control, that is a form of incontinence. And so you can imagine how debilitating that was for someone that was looking after twins for a start, rushing around trying to do everything. And also I like my fitness, so I was really wanting to come back into doing something for myself. There was no information out there for me. There was no help, apart from what there still is, which is to go to your GP, and the GP will either give you some advice or they'll refer you. I did actually get a referral, but not straight away. I had to kind of go a few times before they took me seriously. The attitude was very much like, we've had twins, what do you expect? And women are often being very gaslit by male GPs, and even some female GPs, because they haven't got time for them, or because they think we should just get on and cope with these things, as well as look after, for me, 2 babies at the same time. So I went down that route. I went to see a women's health physio. She gave me pelvic floor squeezes, which over a period of time actually made my symptoms worse. So, you know, there's lots of women with various different forms of pelvic floor dysfunction that are given a blanket treatment like pelvic floor squeezes, and they're not really the ideal solution for them. So I am not really a fan myself, because they made my situation worse. And I got to the point when my kids were 12, so not newly postnatal, where I really had to go and do something about this, because it was affecting every part of my life. So my personal life, as well as what, I mean, by that time I had retrained to be a personal trainer, and, you know, to be unable to help myself and having majority female clients meant that I felt like a bit of a fraud, because I just didn't have the tools or the knowledge to be able to do that stuff. So yeah, I went on a bit of a journey trying to find really something to fix myself and to help me. And so I did a bit of research and found hypopressives being talked about. It was very much seen in Spain and Spanish speaking countries as the go-to treatment for postnatal healing. So I did a bit more research, and very fortuitously a training course came to the UK, and I went on that training course, and that's kind of where my business was born, really. So I went from just kind of doing personal training with women and running female and male boot camps, and doing other kind of fitness activities for people, like classes, to my business is pretty much solely hypopressives now, just because there's a massive need for this form of rehab. And I really, in all the years that I've been doing this, haven't found something that works better than hypopressives. So if I had, I would have gone on the training course and I'd be offering that as well. But I just find that it seems to be that missing puzzle piece for most people, where they have a similar journey to me, and then they just feel like it doesn't quite cut the mustard. It isn't quite what they need to address their issues. So yeah, so that's kind of my journey. And you know, I went from, I had stress and urge incontinence. I'll just talk a little bit about what they are. Stress incontinence is where you leak when you sneeze, cough, laugh, or do any kind of high impact, sudden movements that create large amounts of pressure in your system. And then urge incontinence is where that constant need to go to the toilet, that key in the door moment where, you know, you've parked your car, you put your key in the door and you can't hold it, and you you completely leak. So both of which, as you can imagine, are just really horrible and just really affect people's lives. So yeah, that was kind of where I was coming from before I found hypopressives. And because I didn't have the right information whilst I was pregnant, or even before I was pregnant, about the sort of things that I could be doing once I'd had my kids, it took me that 12 years to find something that actually started to fix the problem. And the reason for me that the traditional treatment, which is pelvic floor squeezes, didn't work very well, was because they actually made the problem worse by over tightening. So traditional kind of treatment is based on the theory that you have a weak pelvic floor, or weak areas in your pelvic floor, and you need to do this squeezing to make those areas stronger. And that isn't always the case. So it's not always like it's not always as clean cut as that. And actually muscles don't work just on pure contractile strength. Muscles want to work where they can relax and be lax when they need to, and strengthen and contract when they need to. So traditional treatment just doesn't really allow for that kind of autonomic response of the muscles. And that's where hypopressives comes in, because it gets to that, it gets the muscles working for you before you needed them.
Yeah.
So just to explain that, that is, say you're going to sneeze, you get like a split second before, and you can't contract consciously all the muscles that are needed to handle that pressure of the sneeze and not cause you to leak. So you need the autonomic, you need your muscles on high alert, ready before you even realize you needed them, so that they can work automatically. So that's the kind of key thing with it, really, is traditional treatment just works on that model that it's weak and we need to make it strong. And that just isn't the case. It needs to be functional.
Yeah. So, Nikki, just quickly, from somebody that doesn't know anything about hypopressives, really, what is the difference between hypopressives and normal kind of traditional ways of teaching you how to use it?
So most traditional pelvic floor exercises involve squeezing, yeah?
Mm-hmm.
And again, just going back on what I said, is it's working on that model that your pelvic floor is weak,
Mm-hmm.
and you need to make it strong. But the pelvic floor is like this hammock-shaped band of tissue that connects from your pubic bone to your coccyx, and it supports your pelvic organs. Yeah, so you can understand why people think it needs to be really strong to hold everything up, but actually it needs to be functional. So when you move, you don't just need it to be really strong, like this solid piece of scaffolding. You need it to be able to, say you're going to sit down or get up, you need it to be able to move with you. So it needs to be able to have that ability to contract, release, relax, do all of these things, support, and not necessarily just be as clear cut as strong or weak. Yeah. And so the traditional model works on muscles to strengthen them, to do that, a bit like if we did a bicep curl, we're just kind of working to build our bicep. And so the theory is that that the contracting will make the muscles stronger, and that to a point is true. But there's also another part of the muscles that need subconscious innovation, which means that just as I was saying, using that example of as a sneeze, that you don't always have a chance to consciously squeeze every single part of those muscles, because that's not how they work. You need some where you didn't even know you needed to use it, but it's working on your behalf. So autonomic response.
Yeah, brilliant.
It's conscious and subconscious. I can talk to you about that because you
Yeah.
understand. So the subconscious is the part of the muscles that hypopressives gets into more. So the other thing is that pelvic floor squeezes work in isolation. So you've got your pelvic floor, you report problems there, that's what's being treated. That is traditional medicine model. Yeah, so your knee is sore, you go to the doctors, he looks at your knee, he treats your knee. He doesn't look at why is your knee sore, what around your knee, what's connected to your knee that might be causing those issues. And it's the same with the pelvic floor. So pelvic floor actually connects into the diaphragm, so our big breathing muscle, and they should be best friends. So what one does, the other one does. They mirror each other. But when there's a level of dysfunction, whether it's from childbirth, whether it's from posture, whether it's repetitive patterns like in your job, that dysfunction means that it's like the best friends that have fallen out. So they're just kind of not talking properly, they don't communicate properly, they're not listening to each other. That's what the pelvic floor and diaphragm get like when there's dysfunction. So whether that's incontinence or a prolapse, and I'll go into what all those things are as well. So if you think about having to get that relationship back first, so we do that by using the breathing. So although, and that's where people struggle with hypopressives, is they're like, well, I don't understand, I need to have a strong pelvic floor. You don't. You need to have a functional pelvic floor. And in order to have a functional pelvic floor, you need to get that relationship back together between the diaphragm and the pelvic floor. So as we start to get that back with the breathing, that they're not just connected in isolation, are they? They're connected like in this big web. So all of your body is connected together. And so as we start to get the best friends talking again, all those deep core muscles start to work differently. And we actually start to change those neural pathways. So how the brain communicates with the muscles. And that's where the magic happens, really, because we start to get more subconscious activation of all of our deep core muscles just through doing really good lateral breathing and getting the diaphragm really stretching and getting the pelvic floor doing the same. So a traditional pelvic floor squeeze, you would be able to feel when you're doing it. You know, as I'm saying it, I'm doing one now. I can feel how everything tightens up, pulls up inside. When you do diaphragmatic breathing, you don't feel anything in your pelvic floor, because all we're doing is treating it to function in the same way as the diaphragm, and we're getting that relationship back together. So you don't get that squeeze, that contract. But you know, by building a better relationship between those two, that when we need it, when we sneeze, when we jump, when we do all those things, those muscles are going to start to work differently because we've reset them. So that's one of the differences. The other thing is we're using a breathing method. So we also use a breath hold, but we'll go into that later. And we're using that breathing method within postures. Those postures work on our posture, funny enough. So they help release tension, which may be causing pain and discomfort, but they help release tension in our body, and they help to put that tension where it's needed. So if you imagine, it's mostly tension at the front of our body, which we call the anterior chain, that causes our posture to change. So it's pulling us forward. We've got this ball and socket joint here, and it's pulling our shoulders forward, it's dropping our head forward, and eventually we end up quite hunched as we get older. So if we could get rid of that tension in the front of the body, and then actually put it into the muscles that are supposed to be holding us upright and stabilizing us, then that would be a perfect solution, wouldn't it? Well, that's the premise with hypopressives, is that we do these postures so that we're releasing unwanted tension and taking that tension and putting it into muscles and making them stronger so that they'll hold and support us.
Yeah,
so very different from pelvic floor squeezes, which just work on one area of your body and very foolishly leave out the big muscle that pelvic floor is connected to, unless you go and see someone who's a very forward thinking women's health physio, and they may give you some breathing exercises to do with pelvic floor squeezes as well. Yeah, that's the main kind of difference. Is it's a whole body approach, because you never know what a bit of tension in your body could be causing in the rest of the network, because we are like this network, this web. Yeah. So if we've got a little bit of tension in our shoulders and our neck, it's causing a pull somewhere else in that web, which if you've got pelvic floor dysfunction isn't going to be very helpful.
Yeah, and really interesting how you use that analogy. Like if you go to the doctor and your knee's hurting, but actually it's because your hip's out or something. Yeah. It's exactly the same. I love that analogy.
You just get, it's like you have a problem, and the focus becomes that problem, where the pain is, where the discomfort is, where the whatever, that becomes the focus. And there isn't this look at the whole body to say, okay, where's that coming from? I mean, when you think about the pelvic floor, it's connected to the diaphragm, but also it has deep fascial connections with the base of your foot. So that fascia that sits on the bottom of your foot is really important when you have pelvic floor dysfunction to work on. So I'm going to show you something because I can see it right here. So this ball is brilliant for, and actually there's a lot of postnatal women that have pelvic floor issues that also have plantar fasciitis, which is a really painful condition of the plantar fascia, that's the bit of the bottom of the foot. So and I suffered a lot myself with plantar fasciitis, and it's like getting out of bed and putting your feet on razor blades in the morning. That's how sore it is. And you know, I used to freeze a bottle of ice and work that over my foot. But we're not told, we're not given that information. That then what happens is, when my niece is doing this, she's gone to someone who treats feet, and looks at her gait and looks at like how she's running, and she's gone and bought an expensive pair of trainers, but actually probably just spending a little bit of time easing the tension out of the underneath of her foot and working on it, and doing some targeted stuff would actually help more than a supportive pair of trainers. So yeah, there's so many things in the body that are deeply connected, and yet we just focus in on, oh, you've got a neck pain, let's work on the neck, but why and what can we do? It's just like this big puzzle that we have to work out. So another big thing that causes tension in the body, and that will be a problem if someone has pelvic floor dysfunction, specifically pelvic organ prolapse, which I'm just going to cover what that is so that if people don't know. So pelvic organ prolapse means that one or more of your pelvic organs has moved out of position. Okay, so if you're diagnosed and you've got a prolapse, that's what it means. It just means it's moved out of position. So the thing with prolapses is that often that movement is caused by pregnancy, and it's caused by vaginal birth. So majority of us that have had children, I would say it's like 99.9% of us have a prolapse whilst we are pregnant, because when baby or babies in my case are growing, there's not enough room for everything to sit where it should do. So pelvic organs move out of position in order to make space for everything that's there. So with that information, we should then be giving women rehab for a prolapse, because we know that they've got one. And I would say that pretty much everybody that's had a baby will have a prolapse. Doing a small amount of rehab for that afterwards would save people from having the problem further down the line, because once that's moved out of position, because everything's quite tightly packed there, you can find that what starts off with one organ that's a little bit out of position, it's resting usually on then something else. So then that will cause that organ to move a bit more out of position. And then we're kind of having this knock-on effect where what could have been just a simple fix ends up being a much bigger problem. And especially when we get to things like perimenopause and menopause. So prolapse can often be that organs moved out of position and it hasn't been addressed. And the other thing that's important to find out if you've got a prolapse is, did you have a birth scar? So, or did you tear, or did you have an episiotomy? Because those are key to causing tension in that area of your pelvic floor. And the tension is not going to be good, because again, tension creates pull. And so if you imagine that little scar in the perineum, it will twist and pull the tissue around it. So unless you're doing some work on that scar and releasing that scar off, then prolapse is going to be made worse over time. And the other thing, learning some real knowledge bombs here, is that if you are given pelvic floor squeezes to do, and you've got areas of your pelvic floor around that scar which are really tight, what a pelvic floor squeeze is going to do, they're going to make those areas even tighter. And that's going to cause even more of a pull. And then that's going to make the prolapse worse. So by giving someone a blanket treatment for all forms of dysfunction, is just the wrong thing to do in the first place. Yeah, you're just kind of basing it on, oh, she's got a prolapse, she's got incontinence, she's got this, she's got that, let's just give them this one treatment. It's like, me hurting the front of my knee, someone else, hurting their ACL, someone else catching the side of their knee, but we all have the same treatment. Bonkers. It's bonkers. Yeah,
it is. And I would have never ever thought about the fact that the bottom of my foot was connected to pelvic floor, like never.
So we don't just have the diaphragm, we have the pelvic diaphragm, and then I think we've got, I'm not clear on all of the diaphragms, but we have another one further up, and then we've got one on the bottom of our foot. I can't remember what they're all called, but yeah, I mean, it's amazing. The fascia goes from like the tip of your big toe all the way up and over to the end of your nose. So that just shows you the web that we're working on. So when you do something for pelvic floor dysfunction where there's tension, and you're adding more tension by doing pelvic floor squeezes, it's just completely the wrong thing to be doing. So that's the thing, is that conventional treatment is really, really outdated. It kind of goes back to Victorian times almost. And yet it's in, you know, why as women are we being given this substandard treatment? Why are we putting up with it? Because we've been gaslit. You know, it's that no one's ever got any time for us to really explain anything properly. There's not the right education out there for women getting pregnant, so that they have proper information about this and this is what you're going to be left with, and this and this is what you can do about it. It's always a bit like, oh, we don't, oh well, what if that doesn't happen? And let's not tell them because we don't want to scare them. Well, if they're going to go through having a baby, you want to know what you can do when you've got out the other side, or even if there's something that you can do before you even get pregnant. That would be the ideal.
I was going to say, I guess some of these would be preventative, wouldn't they, if they were used early enough?
Yeah, absolutely. So, you know, whilst I absolutely champion hypopressives because it's made a massive difference to me, and you know, I can honestly say, hand on heart, that I've trained hundreds of women with hypopressives, and they've all had positive results. They might not have got to exactly where they want to be, but they've still got better results than they would have done by doing pelvic floor squeezes. Now, on the flip side of that, I only see people really who pelvic floor squeezes have failed or have not hit the mark that they wanted them to. So I'm sure there will be some viewers out there that will be saying, well, I do pelvic floor squeezes and I feel the benefit. Fair enough, fine. But the kind of thing that I'm coming across every single day is women for which they've been told, do pelvic floor squeezes, it will sort it out. It doesn't. And then they're told the next thing is surgery. And really and truly, if we can avoid ever having surgery, unless it's like the last straw, that's how it should be used, rather than surgery as kind of almost seen to be that kind of that magic pill, that quick fix. And often it leaves women in worse case scenario than they were before they started. So, you know, I think we should never really be just handing it out like sweets. It should be something that is a last resort, but then giving people options, not just waiting until they get to that point. And then you say, right, well, that's it now, you've got to have surgery.
Yeah. And like you say, if it was prevented before it even got to that point, that would be the ideal situation, wouldn't it?
Yeah, it's a difficult one though, because, you know, if you think about how you go about your daily life, you're not thinking, oh, I better do some hip exercises, or I better do some mobility, and I better do this and I better do that, because when I'm 60, you know, I don't want to have those sorts of problems. It's a really hard one, because at that point in your life, you're not really thinking about, well, I could prevent, you know, myself having a prolapse. You just think it won't happen to you until it does, and that's when you come for treatment. So it is a difficult one to actually get it right, but I do think that the start would be, we give better education to women that are thinking about becoming pregnant, that it's not just all the fluff and the faff and the yes and then you do this. And I remember thinking about a month before, or a couple of months before I was about to give birth, I suddenly had a bit of a panic and was like, oh my God, these babies have actually got to come out of there. All of a sudden I was like, ooh. It was all like lovely, and well, it wasn't lovely because my pregnancy was horrible, but do you know what I mean? It was all like, oh yeah, this is so great. And then all of a sudden I just had this realization that I had to actually birth these babies. So I think that there's a way to go with kind of the information that we give. I think we need to be a little bit more black and white and just tell it like it is, and have, you know, even going back to like the education in schools needs to be different.
I mean,
more realistic.
And we're taught, you know, sex education, and some of this could totally be weaved into that, couldn't it? Is you know, the same way we have periods and like menopause, all of these things, this is so relevant as well.
It is, yeah. But it's, you know, it's a hard nut to crack, isn't it? I mean, my hard nut really is just to give women voices, because most of the women that I'm seeing are quite scared, quite embarrassed, been living with things for quite a long time, not really knowing that there's anything else out there, because it's almost like this is the best kept secret, you know. Not that I want to keep it that way, but it's just kind of like no one's really talking about holistic therapies that are really, really good for women's pelvic floor. It's almost seen as has to be some sort of medical intervention, really. And, you know, our body needs it needs what it needs. And I think that that's the thing is just about saying to women that you might have all of these things going on, that actually it's so common to have a prolapse after you've given birth. But people think it's just them. They don't have those conversations, so they think it's just them that's got this prolapse. And yet, you know, I might go on a call with 10 people and they've all got a prolapse. So it's not just you. And then when you know about it, rather than being really scared to even look at it and address it, just get out there and get the right information and have the right treatment. And, you know, go to your health care provider and say, this isn't good enough what you're giving me. It does not going to address the problem, and it's outdated, because that's the only way we're really going to affect change, is we the people.
And it's that stigma and shame around it. When it's one person thinks that it's just them that it's happening to, that's when people shut down conversations, because they don't want to feel that way.
No, and when you look at the figures around age groups of women and incontinence, for example, you know, they're quite high, as in prevalence of. But what you're going to see with those figures is that, you know, because women are embarrassed, they're not going to report the symptoms. So even if they were asked, they just could be like, oh no, that's not me. Not talk about that. And so there'll be a percentage of those figures that aren't quite right anyway, because there'll be a chunk of those women that don't even want to talk about it, don't want to address the issue. And again, that's kind of almost conditioning. It's conditioned into us that we, you know, just get on with it, do our thing, you know, be the wife, be the mother, be the business owner, be whatever, and all those things, all those hats and plates we have to jiggle. We have to just get on with it. But no, we shouldn't, because the trouble is that if it isn't addressed, even if there's only very minor symptoms, even if there are no symptoms after having children, the chances are that you do need to do some form of rehab. I think every woman should have that opportunity to do some rehab, because it's only going to make things better for them as they get older. Because what tends to happen is some issues are tiny and don't seem to affect their lives, so they just kind of get on with them, and they're living with symptoms. But then what happens when they go through perimenopause is there's this change in the hormone levels, and that will 100% affect the symptoms that they were living with. So at that point they will start to get worse, and then it is a downward slide, because as we go through that perimenopause and then menopause and out the other side, our hormones really change, our hormone levels, and so that means that our tissue becomes more lax. And we know that because we get wrinkles, we get saggy skin, you know, that's just part of aging, and that's happening internally as well. So we need to be looking after our internal system as well, so that when we get into those amazing ages that we're going to go through, that won't affect being able to do all the things that we still want to be able to do, you know, being able to play with your grandchildren, being able to go on holidays and be active, and, you know, all of those amazing things that you want to do well into your old age. However, we've still got to look after the internal workings. I mean, it's you know, you wouldn't have, say you really love Ferraris, you wouldn't have a Ferrari and then never clean it, put really terrible fuel in it, not top the oil up, put the water in it when you feel like it, would you? You'd treat it like a prized possession.
Yeah, yeah.
Why should we not do that with ourselves? We are only here this one life, and we need to really kind of nourish and look after ourselves. So yeah, I think that often when we go through motherhood, I know myself, we're very much on the back burner, and we put others first before ourselves. But you know, there are some very simple things like hypopressives that you can learn, and you just get up and do it. Just, you know, get up and do it in the morning in your pajamas, 10-20 minutes, and you're done. And you know, get into a habit of doing that every day, and then you're looking after your pelvic floor and all that in a deep core musculature and your posture and everything all in one. So it's just a fabulous thing to do.
And I imagine, Nikki, if I know a little bit about breath work, obviously doing the breath work, but I imagine with hyperpressive, that also means that it does kind of relax your whole body as
Yeah.
well, like kind of set you up for the day, as well as helping with the pelvic floor. If you could do that for 20 minutes in the morning, I'm guessing you just generally have probably a much calmer day after that.
It's a really good time to kind of center yourself. That's how I like to think about it. So when I do a session myself, so I've learned all of the foundational stuff, and obviously I've learned all of the difficult stuff as well. But I very much just stick to the basics when I do it myself, because I don't have to think so much about what I'm doing.
Yeah.
Sorry, phone's just got low battery mode. I should be all right.
Oh, yeah.
Yeah,
Well, whilst you're talking, what I'm going to do is I'm going to share your freebie in the group, any on the comments.
perfect.
So
So
I'm
yeah,
just
I
going to do
just
that
find
here.
with my session that that it's just a very mindful time that you can. Sometimes it's really nice just to shut my eyes and imagine I'm somewhere like my dream place, and I'm doing this amazing breathing, and I can feel. I love being by the sea, so you know it's usually by water, and you know it's just a really nice calming way to start the day. You know, it's almost like once you've finished, you wish you could start again. Do you know what I mean?
Yeah.
It's the one. So yeah, in terms of, I mean, I've talked very much about the physical self, but I know that hyperpressives is really, really good with mental health issues as well. Just really to calm everything down. A lot of breathing issues like panic attacks, anxiety attacks, even with medical conditions like asthma, where it's breathing's very tight. With hyperpressives, because we're encouraging the diaphragm to work really as it should do, which is really stretching laterally and expanding the rib cage. Obviously the lungs are underneath the ribs, so we have much better expansion of the lungs, and you know, it's just a really good way of kind of getting everything in that area to move properly, like the rib cage to move properly. So yeah, it's a really wonderful practice, and the plus side is that it helps your pelvic floor dysfunction. So you know, I mean, what could you love
Win-win.
about that? Absolutely. So yeah, I've got a freebie if people are interested. I've got a little freebie that is an ebook, which you've just shared the link.
I've just shared the link.
That's it. And so you can download that and have a little bit of more of an in-depth read about and everything to do with your foof, really. And there is a little video link in that ebook that I've shared, a little teaching video on the breathing. So that's just sort of to get you started if you are a bit curious about what it's all about, really. But yeah,
Oh, amazing.
if anyone's interested in doing any training with me, probably the best way would be to have a look at that little video that's in the ebook, and then if you want to learn the postures, then I have got a 2-week 14-day mini course, and that just takes you through 3 of the postures. So it gives you a little taster of it, gets you practicing it, and then after that you can continue on and do the whole course if you want to, which is you'll learn 8 postures, and those 8 postures with the breathing fit together to form a nice little flow that you can get up and do first thing in the morning, 10-20 minutes. So yeah, that's when I talk about the flow. That's what you would learn, is this lovely flow where you start standing up and you finish lying down.
Amazing. I've posted the link as well for your the 14 days beginner course in the comments as well.
Brilliant, thank you. That's really great. So yeah, and if anyone wants to reach out and have a chat with me about anything to do with pelvic floor dysfunction, then I do have the option on my website to book a discovery call, and that's free. So it's just half an hour where you can get a bit more clarity on what's going on, and we can discuss the process that you'd go through to learn hypopressives if you want to. If not, I can signpost you to maybe some other treatments that you might want to consider, depending on what's going on with you. So yeah, if you wanted to do a discovery call, there's a calendar on my website.
Amazing.
So,
yeah. Thanks, Nikki. Just quickly before we go, just one question. Is there any other therapies that people with pelvic floor dysfunction can look at as well? I know.
Yeah. So often with things like prolapses, especially if you've got a scar, I would recommend finding someone that does some scar release work, or somebody that does release of what's it called, pressure points in the pelvic floor. So often where you've been squeezing so much, or muscles get very, very tight because of scar tissue, they lose that ability to contract and release, so to function properly. So you often need to have someone do some internal release work. So a women's health physio can do that, but you can actually get a specialist that work on perineal scars as well. So if you've got anything like scars or prolapses, then I would definitely be looking at doing some scar release. I also have a really good video that I share from a women's health physio. She shows you how to do it yourself.
Oh,
So
wow.
she's not showing you on herself, she's
Yeah.
showing you on a silicone model, so that you can understand actually it's fairly easy if you wanted to. I did go, because I ended up, because I did so many pelvic floor squeezes, I ended up my pelvic floor got so stuck, it couldn't contract, couldn't release, and so my incontinence got a lot worse. So I had to actually go and have that kind of released off over a number of treatments. And now, if ever I'm like feeling my scar in the shower and it feels a bit sore, then I just do a little bit of massage over it. But I looked at that video I can find the link to the video and share it with you tomorrow if you want. It's only on YouTube.
Fantastic. Yeah, thank you.
Good one. Other things that can help is acupuncture as well. So often people have issues with like rib cage positioning, because when you have a baby, your rib cage usually gets put out, and you get some asymmetry going on in there. So often you can get those releases done through a women's health osteopath or a women's health chiropractor, would be able to help you with things like that. But yeah, there's lots of stuff out there. These balls are really, really good for doing external release as well, sort of around the glutes, and around the pelvic floor area. And often you can find some really sore bits by just rolling over. So you'd sit on it basically, work along the perineum, work along kind of the hip joint, into the glutes. Often with pelvic floor dysfunction, there's that tightness through the hips. So any mobility that you can do that is helping to keep your hips from seizing up and getting really stiff. A good test is to just have a look at yourself in your underwear in the mirror, and just really study what you're seeing in terms of asymmetry. So are you stood to one side? Is your head off one side? There'll be loads of different asymmetries. So any of those show you that you've got some tension and pull somewhere in your web, and it needs addressing. So either you do it yourself, you go for a massage, chiropractor, osteopath. Yeah, there's so many things really that we can be doing, that we don't even think about really, but we should be taking care of ourselves more.
Absolutely. Oh, brilliant. Well, thank you so much, Nikki. And
Yeah,
we
so
did get there
sorry
in the
about the
end.
technical issues. We did
No,
get.
we got there in the end. And it's been great catching up and learning about hypopressives, because I didn't know much about it. So, brilliant.
Thank you.
Well, thank you so much. Thank you everybody for joining. This video will be staying on my page, so please feel free to share it, to tag anybody who needs some information about pelvic floor health. Nikki's page is also on this as well, and the links are in the comments. So thank you so much everybody, and thanks Nikki. Bye.
Bye.